Hello, and welcome to another live stream of Cutting Edge Health. Today, we're talking about food and mood. And for those of you who have thought about us as predominantly a pain channel, I know a number of you are like, how does that relate? So previously, about 2 years or so ago, during our live stream, we had a guest speaker who talked about how food can be able to impact not only the aspects of emotional components, but physical, where she talked about the elements of how it causes inflammatory portions of our body to be worse and how it can increase and cause pain. And one of the things that we didn't really look into is that emotional quality of how the two are interrelated. What many people would say is, oh, it's not physiologic, it's more emotional. And this video today is going to be something that debunks that completely. We're going to talk about food and depression and how they interrelate and how your food choices can be able to improve your mood or how it can worsen it. But as you guys know, when we talk about depression, there are a number of different things that in play, right? So when you look at depression as a whole, one of the things that we know is that it can be both physiologic as well as it can be emotive, meaning emotional, and it can have issues that are associated with mental components as well. There are thoughts about whether they're genetic pieces that have an interplay. But at the end of the day, many times when people think about food and mood, they just think about, oh, I just made bad food choices. I was taking a look and I was really just so much into that steak. And it was like, oh, this is going to be the best thing ever. By the way, yeah, I know it's close to dinner time and I'm definitely going to make you hungry. Or, hey, I just really wanted some sweets and I just wanted to indulge and have a good time and feel better. Or I just wanted to kind of sit down with family and friends and just really just enjoy a good meal that was just something that just kind of really hit the spot. Or, you wanted that quick sort of sugar fix and you just felt like, you know what, I had to pay for it later. Right? Where you said, man, I'll get some donuts are in our area, Amish donuts that are just delectable and really are fantastic, right? And you're just over here like, yep, you're so excited to get that. But then afterwards, after being so excited, you feel like this whole letdown, right? People talk frequently about Thanksgiving and tryptophan and whether that's significant. And we're going to talk a little bit about that today. So when we talk about mood and food, one of the things that we really want to kind of define is there any research behind it? Because that's really what we lean into a lot when we talk on this channel, right? And yeah, there are a number of different studies. So some of the studies are actually, there's studies out of Yale that looks at eating poorly and depressed and how there's a potential connection that's in play. Right. There are studies that have looked at can changing your diet help tamp down depression and potentially be able to boost mood. And there are others that are out there like diet and depression. If there's going to be a Yale study, there's no way in the world I'm not going to have my alma mater, Harvard, present on here. So there's a Harvard study that looks at diet and depression and evaluates that, yeah, there's a connection. So we're going to talk about that connection in just a second or so. But let's talk about depression as a whole, get some contextual understanding of it, and then let's go back and then talk about how those two interrelate on an actual physiologic manner. So when we take a look at depression itself is a mental disorder. This is put out by World Health Organization that's globally estimated to affect about 5% of adults. It's a leading cause of disability worldwide. In theory, it's supposed to affect more women than it does men, and depression can lead to suicide. And obviously there's different severity, where it's mild, moderate, and severe in nature. When we talk about depression as a whole, it's estimated in the US about 66% of US adults age 18 or older will have at least one major depressive episode in a year. And of those individuals with severe impairment, about 72% have received treatment. So as you can kind of see where we're going with this, before you talk about doing medications or even more fancier type treatment options like ketamine and TMS, things that you guys know that we have talked about on our channels before and we have resources for and all those type of things, you'll see the different banners that talk about how we evaluate it, how we can be able to improve it, and all those type of things. But at the end of the day, what we really want to know is how can we maybe be able to prevent it? How can we be able to look into depression from a much broader sense and understand that as we look at depression, really, there's a lot of things that we need to understand. So 19.4 million Americans in the US have had at least one episode. The prevalence, as discussed before, is about 9.6% in adult females and about 6% in males. And adults with major depressive episode was highest among individuals 18 to 25 years old. The major depressive episode was also higher and more prominent for those who reported it being biracial. And there's different graphical representations that show that when you kind of take a look over here at the right side. You can see the gender disparity or gender breakdown and the age breakdown as well. So all those things kind of play a role in terms of taking a look at, what are some understandings of depression? But then really what we want to know is how does food interrelate? And so there's been a number of different things that kind of connect that, right? So we have this aspect of food as medicine, which has really been touted by a number of different options out there, particularly like Cleveland Clinic. There have been different books that have looked at how does the brain interrelate to food. So this is your brain on food, and you can see that there's these connections, and you can see another Harvard reference, of course, that takes a look at how food can be able to impact depression, OCD, anxiety, and other pieces. Another book, The Better Brain, that looks at how nutrition is able to connect to being able to improve this. And actually, there's a discipline that's called nutritional psychiatry that looks to be able to improve mood by really looking at diet and how it can affect it. And we're going to get into some studies that really kind of reflect that physiologic piece. But let's talk a little bit about how sometimes medications that you take can possibly affect it for the worse. So let's say that you're on meds, right? So if you're on something like gabapentin or Neurontin to try to be able to treat a nerve pain, it can cause you to have a folic acid deficiency. And these deficiencies we're going to talk about, as you can kind of see, just to kind of make a quick sort of divergence for a second. One of the things that we've talked about is biomarkers and how to be able to assess deficiencies that are present within our overall health, and traditionally from a nutritional standpoint, particularly in response to pain, but there's an overlapping element that takes place with depression. And so if we can improve these things through simple measures, then maybe we don't need to do as much on the upside to try to treat it with a more advanced type technique. So let's take a look at some of these different medications, the deficiencies they can cause, and then we'll talk about how to be able to treat those deficiencies. So gabapentin used for neuropathic pain can end up resulting in a folic acid deficiency. Different types of insulin can cause magnesium nutrition or deficiencies that are in place. Lipitor can cause problems with coenzyme Q10. Crestor, the same thing. Lisinopril, which is a blood pressure pill, can decrease zinc. Metformin, also used for diabetes, can cause B12 and B9 deficiencies. And omeprazole, which is used for reflux disease, can cause both magnesium, B12, calcium, and iron deficiencies, all of which have potential impacts on depression. So one of the studies that really has kind of looked at this and gone into the physiologic understanding is the following. Finding intestinal fortitude, integrating the microbiome into a holistic view of depression mechanisms, treatments, and resilience, the neurobiology of disease. All right, those of you who are with me live, do not just cut off because all of a sudden we have a fancy title. As you know, we're going to break this down, explain it to you so that you can understand it and that this is not going to be tough. So we're going to explain it to you like you're 5 years old. Okay. So don't get freaked out. So let's go back to that title and have a better explanation of what really does that mean. So what that means is the following. So what we're doing is we're taking a look at how the gut, which is that microbiome and what exists in that area, how it connects to depression, what are the ways in which it connects, and how to be able to treat it. All right. So the better way of saying this for a lot of people is to say, okay, can we be able to identify what are some of the problems with a diet that can cause this? And then can we show you a pictorial representation to give you some understanding? So looking at that, this is kind of that synopsis. And that is the gut microbiome can affect depression and it's bidirectional. So what does that mean? It means the gut doesn't just talk to the brain, but the brain talks to the gut. So when we look at this, we really need to have an understanding of how that happens. And we're going to explain that. And it occurs through a number of different mechanisms. It can occur through the nervous system. It can occur through the endocrine system, and it can occur through the immune system. The gut microbiome can alter the balance of local and circulating inflammatory markers in the activity of immune cells. So as we had talked about in reference in that previous video from 2 years or so ago, we know that that gut and the diet intake that we have can impact inflammation. And that inflammation can have other downstream effects than just the physiologic, but it can also impact mood, right? And then we also know that the gut microbiome can affect something that's called the HPA axis. And so what that HPA axis stands for is hypothalamic pituitary adrenal. So I know that's a mouthful, and I'm going to repeat that in just 1 second. So again, it stands for hypothalamic pituitary adrenal axis. And so what does that mean? So the hypothalamus is a portion of the brain, as is the pituitary that releases hormones, and the adrenal are organs that sit above the kidneys that all have a hormonal response, and they interconnect and talk. Finally, the gut microbiome influences the brain through altering tryptophan metabolism and producing other neuroactive molecules. So I know historically we don't traditionally talk about tryptophan until we talk about Thanksgiving in November. But if you recollect, for those of you who joined us for our biomarker talk, maybe about 3 to 4 weeks or so ago, we know that tryptophan has a breakdown into different pathways for neurotransmitters, which are actually pretty important. And we're going to reference that in just a little bit. And all of these three systems can have issues with balances in terms of the gut and give an issue with the role of intestinal permeability. So I know this is a lot of fancy biology. I get it. But hang in there with me. What we're going to show you is how these guys talk to one another and how that impacts you, right? So pictorial representation to be able to get a better explanation of it. So as you can see, there's the gut microbiome over here on the left-hand side of the screen, and then kind of this mood or mental state that's present over here on the right side, i.e. depression, right? And then we can see these three different types of systems that are in play: the central nervous system, the endocrine system, which is that hypothalamic pituitary axis that was made reference to before, and then the immune system. And all of these are like conduits. It's the same way as if you had hardwired telephone wires, or you had old school telegraphs, or you had a cell phone connection from one to the other, right? You can be able to see this communication that is just not a one-way street, but it's a two-way bidirectional component of how the gut responds to what's going on from a mood and how the mood responds to what's happening in the gut. So what we really need to have an understanding about is, so what are our triggers, right? What are the things that make some of these things work? Before we get to that, let's talk about the intricacies, because we made that a simple representation. So that title we talked about before wouldn't be so scary. So now we have an idea about, oh yeah, okay, I get what you're saying. Basically, it's the gut being able to talk to the brain, and it uses either the immune system, the endocrine system, or the central nervous system in order to do it. Got it? All right. So with that, let's get a little bit more detailed. So when we take a look at this, now you can see the interplay of the various different factors that take place, whether you're talking about things like cytokines, or whether you're talking about transit elements that take place that affect the permeability of the gut, or how it alters the hypothalamic adrenal output from what happens from a downstream effect from the area of the head and the brain, and how those things influence tryptophan metabolism, right? So all those things are kind of like super fancy, but at the end of the day, what we need to figure out is what are our deficiencies, and then how do those deficiencies, as we may mention before, impact things like this, where we look at depression and how you have that gut microbiome, mitochondria dysfunction, things that happen with oxidative stress, inflammation, epigenetic changes, and all those things that really play a role. So as mentioned before, we talked about tryptophan, and tryptophan itself, it has roles in terms of pathways of how things kind of talk to one another. For those of you who were really paying attention to our biomarkers, we can notice that this is one of the biomarkers that's studied for inflammation and pain. And you can see it also plays a role for that of depression. And so you can be able to assess that. So where are some of these elements of depression really significant with? So one is going to be taking a look at micronutrients. And so we talk about micronutrients. One of the representations of this is deficiencies in terms of what we're eating. And some of those things are going to be things like vitamin D. So 94% of Americans are deficient in vitamin D. In addition, they also have deficiencies in choline, vitamin E, vitamin K, magnesium, calcium, and vitamin C. Some of the other micronutrients that can have issues with are B12, B9, B6, iodine, selenium, and that is one class of issues from a gut standpoint that can cause you a problem. The best way to be able to have an understanding about this, though, is measuring it, right? You can try to say, hey, you know what? I'm going to figure out how to be able to deal with this, and I'm going to take in way more calcium because I know that I probably have a deficiency. Yeah, but then you're going to cause an imbalance in another way. So in essence, what you really need to be doing is taking a stock of saying, what are my micronutrient deficiencies? And then how do I be able to replace that? By the same token, as we kind of take a look, we can be able to see that there's other things besides just micronutrients. We can see that there are things like hormones that can cause problems, right? And traditional hormones that you would kind of expect would be things with like thyroid hormone, estrogen, testosterone, and things of that nature. But in addition, you also have minerals that can be problematic, whether you have issues with chromium or you have issues with having problems with iron deficiency or mercury or lead or zinc. These all have an impact on problems with mood. And to be honest with you, as a physician, and I think I'm a pretty sophisticated physician, I would not have looked at all this interplay until I decided to look into the elements of inflammation and now saw the cross kind of pollination, if you would, of how it impacts pain. So there's actually a number of different programs that are out there that are looking at how can you be able to use food to be able to impact depression, and how to be able to say, okay, if we're going to deal with depression, let's put out some things that really make sense. Well, one of the things we want to consider doing is increasing essential fats, how to be able to increase intake of vitamin B vitamins through using food sources, how to really be able to look at what are the essential amino acids and serotonin and what to do about it, how to increase intake of chromium, how to be able to increase magnesium and vitamin D, and look at foods that can be able to decrease inflammation, not just for a pain's sake, but for a mood sake. And this is interesting because for those patients that say, you know what, hey, I have pain, but I also am depressed, and just think that the depression is secondary to obviously the pain and not being able to do the things that you want to be able to do. Well, it very well may be that you also have a nutritional deficiency that's overriding all of this and causing both problems, or at least worsening the problems from where they stand. And that's one of the things that we're looking at, how to be a little bit more advanced in identifying how can you provide value to patients so that you can be able to have solutions. Okay, so I think there's a question in here from Elaine that says, can all those vitamins be determined by blood tests? So the fact of the matter is, not all of everything that we're talking about right now can be determined by one blood test. But what we mentioned in our biomarker talk was that there are different ways to be able to assess for some of these using urine. There's some ways to be able to assess it via blood, but we can get a holistic picture of you as a person, make some identification of what are the most common things and what's some of the easier tests to do. And then after that, if those things aren't a problem or issue, then we can be able to look more with a deeper dive. Can we look at intracellular micronutrients and be able to identify it? Can we look at mineral deficiencies? And what we're going to talk about in just a minute or so is that has to deal with food sensitivities, which is something that really doesn't fit that commonly in traditional allopathic medicine. Yeah, there are allergists that are out there, but we normally don't look at how that has a downstream role for inflammation and for things like depression. Okay, one of the other commentary that comes up was from Vicky is, if I make poor food choices, I can guarantee my pain will be greater the next 2 days. And I would say that that's pretty, not pretty unique. It's pretty common, as a matter of fact. We have a number of patients that say, you know what, hey, I know if I choose some processed food and I really get after it, that then I end up having so much more of a terrible bout of pain. And honestly, that's also sometimes what happens with mood as well. We think that, oh, I just feel bad because I overindulge. Not necessarily the case. It can be because your diet as a whole isn't necessarily the best. So look at some more science. So this paper in Psychiatry Research looked at dietary patterns and depression risk, and it's a meta-analysis. And for those of you who are super fancy, who've been following the channel for a while, as we know, that meta-analysis really kind of looks and pulls different researches, and it says, okay, this paper, and this paper all support this, and gives us an idea about what does that really mean. And so what they really kind of came up to and sort of had a universal theme, which we'll summarize without taking you through all the tables and everything else, is that there is associations between dietary patterns and depression risks. And unfortunately, as we probably kind of gathered, the Western diet pattern is associated with an increased risk of depression. So those are going to be things like processed foods, all the type of things that you know are historically bad and have been told are bad for kind of cholesterol and cardiac health, as well as you having different problems for increased obesity, as well as likelihood of diabetes. Now, we know that it has differences with these micronutrient deficiencies, having issues with mineral deficiencies, having issues with having problems on a whole holistic way that then have an impact on potential mood. Healthy diet pattern is associated with a decreased risk of depression, and it makes sense to look for scientific rationale for formulating dietary guidelines. Okay, so let's make a little bit of a divergence, because we've talked about things like micronutrients and hormonal as well as minerals. But one of the things that we don't talk about, and I kind of like really sort of skirted just a little bit, was the element of food allergies, right? And so different types of food sensitivities are going to be things that deal with things like IgG, IG4, and IgA. So when we talk about IgG, it's an antibody that's specific to having issues with certain types of foods, and you can do different food sensitivity tests to be able to associate it. IG4 are antibodies to foods that will not usually cause inflammation, though high amounts of these antibodies indicate the presence of immune activities against food antigens. And then IgA is traditionally found in mucous membranes, including the digestive tract, and they're elevated to a particular protein, can increase an immune response and mucosal irritation. So those type of things are really important when we take a look at, okay, how are you dealing with certain foods that we may not necessarily think would be a problem, but end up causing issues? All right. I think we got a couple different questions coming in, or commentary. So one was, I canceled surgery on my foot once I changed my diet drastically. That's a good thing, to be able to have the ability to be able to avoid surgery. Okay. And are there studies that a plant-based diet can improve depression? That's an interesting question. And I really didn't want to kind of get into the full depth and detail of this. However, so there are studies that have looked at that maybe a plant-based diet might actually cause some degree of depression. And I thought that that was really unusual. As I was taking a look at some of these studies, I was like, are you serious? I would have thought that, it would definitely do that. This plant-based diet, it should be in theory way healthier, that you shouldn't have, quite as much issues from animal byproducts and such, and you should have less inflammation, which I think you go on to say, right, as well as inflammation. But no, there are some studies that have looked at plant-based diets and those diets having problems and issues with increase in depression and mood. As a matter of fact, if you hold on for just 1 second, give me a moment. I'll see if we can be able to kind of pull up that study. Give me just a minute and I'll see if I can add that. All right, so I think you can be able to see this once I move this out of the way. And let's expand this up just a little bit. And so, yeah, this was published in Psychology Today. And I want to say it's a study about maybe 4 years or so ago that looked at the connection between vegetarianism, and depression, and how they found that those who were non-vegetarian may have a decrease in depressive disorders, which is incredibly unexpected, at least from my standpoint. I wouldn't say that this is probably typical of everyone, but one of the things that they talk about is the deficiencies that may be present. And for instance, they relate a number of different studies where they say a study of 140 women found the odds of depression were twice as great in women consuming less than recommended intake of meat per week. So that's not to say that I'm trying to tout that, don't be a vegetarian because it's the worst thing ever. No, I think that there's certainly some benefits to appropriate dietary selection. However, it looks like there may be some impact on mood for certain people, right? So kind of what's our takeaway? So that way you can be able to have a few things that you can really set a hold on to, particularly when we talk about micronutrient, hormone imbalances, and minerals, and what are some of the things that you can do to be able to deal with it? Well, let's take a look at 4 different vitamins and how that can be impactful in order to be able to improve health, right? So you can take a look at vitamin D, which is a pretty common deficiency, as we mentioned earlier. Let me go back real quick and sort of show you that deficiency piece and what were some of the most common ones. I think I can find it, and that's here. So vitamin D is pretty common in terms of deficiencies that are in place. Right, 90% of people do have this, and it has an impact. Vitamin B, which you can be able to replace with a number of different foodstuffs, particularly those that have to deal with fish and other treatment options. And so when we take a look at vitamin B as a potential piece, I'm not so sure that this particular slide mentions it, but there's a number of them that do. And then we take a look at omega-3 and zinc, which certainly are treatments that you can be able to utilize, or foods that you can be able to utilize to try to be able to improve your overall health. And not just that, but also your mood as well, in a protective, preventative way, so that you can be proactive in being able to improve not only your mood, but potentially also your overall inflammatory state. So hopefully improving your health as well as decreasing pain. So again, one of the things that we wanted to talk to you about was how to be able to improve your mood, how to be able to use food in order to do that, and understand that there is a basis of interconnectivity of this, and that really there's much more science behind this than what you expect. And you think that it's, a bunch of hoo-hoo, foo-foo stuff. Not even close. There's way more science that really relates to what the underlying nutrients, neurotransmitters, and hormonal communication happens to be. And really, there's a reason for why when you don't necessarily eat your best, sometimes you don't really feel your best. Thank you again for joining us, and stay tuned next week to having another conversation about how to be able to improve your overall health. And always, we really appreciate those of you who join us. Thank you so much for supporting us and really appreciate it. And you guys have a great day. Take care.